Good day, this is Maria Susielengbino of BSN 2B, and I will be demonstrating on how to administer oral medications. So the first thing that we are going to do is to always perform hand hygiene. Next is we are going to prepare the medication by acknowledging the 5 rights of medication, which are the right patient, right drug, right dose, right route, and right time. So next is we are going to check the doctor's order, which is give paracetamol 500 milligrams, 1 tub per RM every 4 hours as needed for temperature greater than or equal to 38 degrees Celsius. Next is we are going to compare with the medication and the medication ticket. So it says here paracetamol 500 milligrams. We're going to compare the actual drug to the medication ticket and the doctor's order. So after preparing the medication, we must go to the patient's room and knock the door 3 times, and as we go inside, we must greet the patient and introduce ourselves. So, hi ma'am, good day. I am your student nurse for today. So before we proceed, we must verify our patient's information by asking his or her full name and date of birth. So may I ask your full name and date of birth?
I am 8 years old, and my date of birth is February 7, 2008.
So we verify this information by looking at the patient's ID band. So next is we are going to check the vital signs of the patient by taking his or her temperature. So the patient's temperature is 38 degrees Celsius. So based on the doctor's order, you need to take a paracetamol of 500 milligrams based on your temperature of 38 degrees Celsius. So I will be giving this medication to you to make sure that your temperature decreases back to normal temperature. And I will be getting your temperature again after 30 minutes. So before we proceed, we must assist our client or patient to a semi-polar position or sitting position. So I will be opening the medication right now, but as we open the medication, we must make sure that we do not touch the tablet inside. So the next thing that we're going to do is we are going to ask our patient if what is her preference of taking the medication. So ma'am, what would you prefer? Would you prefer that I will put the medication on your hand or on the medication cup?
Medication cup.
So we are going now to give the medication to the patient. So please tell me if you feel any symptoms like headache so I can document it. And moreover, ma'am, the therapeutic effect of this paracetamol is to lower back your temperature. One of the adverse effects of this paracetamol is allergies. So the possible side effects also is drowsiness. So if you feel sleepy, you can go to sleep. And so if there are any discomfort that you feel, please don't hesitate to press the nurse button. Just that is just connected to our nurse station. So in liquid medication, we must pour the medication on the medication cup but to the eye level. And upon holding the medication bottle, we must hold it like this with our hands to avoid spillage of the medication on the label of the bottle. Here is the medication cup, and here is the calibration. So we're going to pour it to our eye level. So we're going now to give the medication to the patient. So in line of documentation, we must put the date here. 10, 18, 21, 4, temperature greater than or equal to 38 degrees Celsius. So we are going to put the drug here, which is paracetamol. Dosage is 500 milligrams or 1 tablet per RM every 4 hours. So in here, we are going to put the time of medication administration at the A, which indicates AM, and our initials beside the time. Next is we are going to put our signature together with our initials. And signature.